Could this small endoscopic spine company that most of you have never heard of sell for buku dollars in 2024? I think it's possible. Hear me out. A few weeks ago, I posted a video about Arthrex's first foray into endoscopic spine. Arthrex didn't pay me for that video. We didn't talk about it before or after. I don't even know anyone that works there. That video blew up for us, 25,000 impressions, and the emails are starting to stack up from marketing directors. I'm working on a few videos across different specialties, but I received an email recently from a hospital administrator saying, you need to take a look at the dual portal system. And when I said, what's that? She said there's exactly one company that advocates the dual portal system in the endoscopic spine world. So in order to discuss this, we need to take a look at all the single portal systems and the dual portal systems in juxtaposition. Why has endoscopic spine surgery been so slow to be adopted in the U.S.? Pretty simple. There's three reasons. I'll give you all three, okay? Number one is cost and reimbursement. Those towers are $250,000 to $400,000. Reimbursement's been spotty. Only recently have people started doing fusions endoscopically, and of course they're being able to be reimbursed on those fusions. Number two reason of slow adoption is the learning curve. The companies themselves say it's 70 or 80 cases to be proficient. Now, back in 2020, I was going to enter the endoscopic world and change spine forever because I had an endoscopic spine surgery and it changed my life. Once again, thank you, Dr. Derman. I conducted 3 different cadaver labs, some in Austin and one in Dallas. I had surgeons at all 3 get up during the labs and leave, and I would follow them into the parking lot. I followed 2 surgeons in particular one day and said, were the Chick-fil-A chicken biscuits not good enough for breakfast? Like, why are you bolting on me? The surgeon on the left said, the view through the endoscope of the spinal anatomy is totally backwards to me. I'm not used to seeing it that way. I don't have the bandwidth to pivot my busy practice right now to dedicate the time to learning that. I'll do it when I'm forced to learn it. Fair enough. The other surgeon said, I will be forced to train on this when the surgeon across the street or down the block hangs their shingle out that they're doing endoscopic spine, and then I'm forced to do it. Again, fair enough. The number 3 reason of slow adoption for single portal endoscopic spine surgery in the U.S. is the pathology addressed. Now, numerous surgeons I spoke to when researching this video tell me a far lateral discectomy done through an endoscopic approach is the gold standard. It's the way you want to do it. But again, do you have the tower? Do you have the huge amount of cases underneath your belt? So then that makes me pivot over to the dual portal system. Now, Amplify Surgical, I'm not being paid to do this video. I don't know the people there. I have done some research on them. I hear great things about them. Look at the picture that I have up now behind me. What does that remind you of? That reminds me of my orthopedic, total joint, and arthroscopic surgeon days. I know these surgeons very well. They're as practical and as self-aware of any surgeons on the planet. If they could perform those arthroscopic surgeries through a single portal and do them faster, as reproducible, and have the same results as 2 portals, they would have been doing it a long time ago. Trust me. Let's look at Amplify's website. Looks like the name of their implant's Dual X. This looks like the kind of the shape of the implant. It looks to me like these expand vertically and laterally. Now, that's one of the things I'm seeing on x-rays of the single portal cages that are out there right now. I think of subsidence, and it's no knock on these companies, but they're only getting a very tiny cage that's not expanding very much in the single portal system. Imagine the flexibility and the visibility of having a camera that you can aim to look at the inserter and the implant, and when you're doing the discectomy, it obviously has inherent benefits that you don't need me to explain. Look at the x-ray, pretty big footprint. All of these delivery systems, which we can talk about, I was an old NuVasive guy, had awesome retractors. We would fly people to San Diego. We would be like, look at this retractor, look at the shims to prevent tissue creep, look at the cool lights we have on there. Let's go play Torrey Pines. Now, those things were cool, but they were a smoke screen, and it's not a bad thing, but the retractor and all the delivery systems were a smoke screen for what? The cage. The cage is the alpha in that relationship. That's what was being able to pay for everything, and these cages that we're putting in there. So let's go up here and look at their other page here, the dual portal page. You can find their website. Looks like they have a spine symposium coming up. I looked up the CEO of this, Andy. Andy, This is a very busy invite here. I don't know you, but we need to work on that. That color scheme, I don't know what's going on with it. But those that are interested can look on here. It's March 9th in 2024. Endoscopic Spine Symposium. They're going to talk about these technologies. It's in Orange, California. And there's that picture that I lifted earlier. It looks like they have videos from a Dr. Park, who's with UCLA Department of Orthopedic Surgery. I've watched a couple of these videos. He's a great speaker. He relays the information very well. And from what I picked up, the CEO of the company is a Korean gentleman who learned this technique in Korea, where it's been perfected over the last few years. He brought it back here. This hospital administrator told me, here's what's awesome, and here's why I think they can get bought out. You can integrate this system and use the existing endoscopic towers that you have there. So Stryker, are you listening? Smith & Nephew, Olympus. You can actually give surgeons the best of both worlds with your technology on the endoscopic towers. There's no way that you can't convert immediately to a single portal and a dual portal system with your existing technology. But what's the difference is you don't have the cages. I'm guessing, since this has been out for 2 years, they probably spent a number of years locking these patents up tighter than my waistband on my third plate at the Golden Corral buffet when grandma's in town, because that's her favorite place to eat. So buy this company out, keep this guy on. This OR manager, OR director said that Andy, the CEO, he covers every case by himself. He trains all the surgeons by himself. You're getting a just wealth of info if you buy this company, these cages, and bring him on for a few years. He looks like he's developed products for other companies before that have sold for buku dollars, and now he wants his own shot to get up to bat. So, Andy, if you're watching this, email me at admin@tinyincision.com. I want you to come on the podcast. Let's discuss this, because undoubtedly some of the single portal evangelists are going to come after me for this. And I'm not knocking any of the systems. Every system has its own place in the market. But the name of the game, let's be honest, is getting this to as many patients as possible and making as much money as possible from the top to the bottom. So if you can have a lower barrier of entry and train a ton of guys on this, and you're not having to spend a whole bunch of money, and you can use the existing towers that are in the hospital, this seems like a win-win. For those that have anything to say about this, put something in the comments. I'm intrigued to know what you think about it. I've been in the spine game for a minute. I'm not saying my opinion is the end-all be-all, but I'm saying taking a look at this dual this dual endoscopy, dual portal system for endoscopy is intriguing, and I want us to flesh this out a little more. Thanks.